Welcome back. We're trying to understand exactly where are we as far as the challenge against corona is concerned. It's the 9th day now. We're moving into 9th day. It's Navami today, and my best wishes to all our viewers who possibly would be watching this broadcast at home. On another day in normal times, this would be a great festive moment. But today, there is nothing to celebrate as such. The best way to celebrate is simply to stay at home, stay safe, and avoid all possible contact. That's why this lockdown is there, and we need to ensure that this lockdown is successful. In between this lockdown, there are some people who really deserve our tribute. They really deserve to be saluted. We call them Corona warriors. Nurses from the All India Institute of Medical Sciences in the national capital are pooling in money from their own pocket to feed daily wagers who've been stranded due to a lockdown.
इस वक्त मैं मौजूद हूं एम्स अस्पताल के बाहर और बहुत सारे संस्थाएं ऐसी हैं जो कि दिहाड़ी मजदूरों के लिए खाना नाश्ता की व्यवस्था कर रही हैं। इस वक्त यहां पर जो है एम्स के जो एम्प्लॉई हैं, जो नर्सिंग स्टाफ हैं, वो आपस में ही पैसा इकट्ठा करके यहां पर जो दिहाड़ी मजदूर हैं इनके लिए यहां पर चाय नाश्ते की व्यवस्था यहां पर कर रहे हैं। देखिए, बिस्किट का पैकेट है, चाय की व्यवस्था, और लगातार अपील भी की जा रही है यहां पर इन लोगों से कि ये सोशल डिस्टेंसिंग मेंटेन रखें। आप क्या करते हैं एम्स में?
हम नर्सिंग ऑफिसर्स हैं। हमारा एक व्हाट्सएप ग्रुप है AIIMS, उसमें अराउंड 250 नर्सिंग ऑफिसर्स हैं। हम इनको एक्चुअली लंच और डिनर सरकार दे रहे, ब्रेकफास्ट का कमी है, इसलिए हम छोटी ब्रेकफास्ट अपनी तरह से इनको देना शुरू किया है।
हमारा सैलरी से थोड़ा पैसा इकट्ठा करके हम वो पैसा से वो लोगों को ब्रेकफास्ट दे रहा हूँ।
Well, let's go to Revati. She's joining us live from Bengaluru right now and find out what's happening in Bengaluru. Revati, in Karnataka, you know, there are do-gooders everywhere. But firstly, just bring us up to speed with what's happening as far as the Tablighi Jamaat episode is concerned. Any more contact traces?
Well, the Karnataka Health Department has got a list of 1,500 people who may have attended the congregation or come in close proximity. Now, the state government has traced around 800 people and is in the process of tracing the other 700 people. Out of these 800 people, 143 people were symptomatic. Their swabs have been collected and the test results are awaited. So far, only one positive case related to the congregation is the person who died on 27th March. Apart from that, we do not have any more cases reported, but test results of these 143 people are still awaited. So probably today or tomorrow we will know the results of those, and also others we will need to understand as to how many days they have been here in Karnataka after they returned from the congregation. Now, those who returned within the last 14 days have been quarantined in a government facility, and those who have completed 14 days have been asked to stay at home. And also, meanwhile, the government has put out an appeal for people, if they have been part of this congregation or come in contact with anyone who had been, then to come out and self-declare those details. So that is as far as the Nizamuddin congregation goes. Now, overall, on another side, Karnataka government also has this concern of a cluster in Mysore where 12 employees of a pharmaceutical company have been tested positive. Now, the first patient here, patient 52, did not have any foreign travel history or contact history, and at this point we do not have any idea where he contacted the virus from. Samples from the company has also been sent for testing to see if some sort of an import has led to this this situation. But at this point of time, 12 employees of the company who had no travel history have been tested positive. So more than 1,000 employees here from this company have also been home quarantined. So two concerns for the Karnataka government at this point of time. One is the Delhi connection, and second is this cluster in Mysore.
All right, Vinaya Deshpande is there in Mumbai. Vinaya, in Karnataka, of course, Tablighi Jamaat remains a critical question. But in Mumbai, Vinaya, since yesterday, I'm getting to hear from a lot of people I'm speaking to that there is a huge spike which is now being witnessed, that there are small hotspots which have now come up in Mumbai. How accurate are those reports?
Well, yes, there are a few hotspots that have been coming up. In fact, Bhupin, several areas have been declared as containment zone by the Municipal Corporation of Greater Mumbai as well as the Mumbai Police. We saw several such stringent actions within Mumbai in the last 2 to 3 days. It started with the Varli Kolivada, where 35,000 people were contained in the very same Varli Kolivada area after 7 persons were found positive. Yesterday, the count from there rose to 15 15 COVID-19 positive patients from there. Several other areas were also contained yesterday, may it be the Matunga area, also the first case from Dharavi, as we have seen in one of the SRA buildings. It's a cluster of 9 buildings, and in one of those buildings a 56-year-old man tested positive. He had a garment store. He went to a local doctor on the 23rd. So clearly right now contact tracing has become a priority issue which is being done aggressively by the government. But also what is being done parallelly by the authorities is searching for people who had possibly attended the Nizamuddin event last month, and that is what is being done in several parts and pockets of Mumbai slums at present. Bhupen.
All right. And if how serious is this Dharavi threat? One person has already succumbed. I'm sure the authorities would be looking at the scenario there very, very closely. But any word coming in from the local health authorities if there are more people who would have already tested positive? And what about contact traces? Do we know this person who died, around the family members of this person? Would there be other contacts as well?
Well, of course, and why Dharavi is a primary concern for the health officials is it's the largest slums in Asia, so the density of population is really very high. We are talking of a 56-year-old man who went to a private doctor first on the 23rd, thereby taking chances of infection to many other persons as well. He owned a garment shop, so clearly when people came and visited him possibly in the shop as well, that is another point of contact. He was then thereafter taken to Sion Hospital where he was admitted, so that is another set of contacts. Right now we are being told by the health officials that he lived with 7 other family members, his wife, 2 sons, 4 daughters. All 7 of them have been quarantined. They will be tested today. The entire SRA building in which this person was staying with his family for the last 2 years on rent, even that building has been completely quarantined and people are being tested. Right now the authorities are aggressively trying to trace the contacts of this 56-year-old, and that clearly is going to be a humongous task because we are talking of Dharavi where several public resources are shared within people. There are no private bathrooms or toilets. People share several facilities. It's a cramped space with barely any movement space, so people move from one place to another quite quickly. There is no sense of privacy in that sense. So in many senses the case in Dharavi will turn out to be a nightmare for the public health officials. But this is not the first case reported from Mumbai slums. We have seen that in the last few days, may it be the Varli Kolivada slums, may it be the Ghatkopar slums, the Kurla slums, the Kalina slums. Several cases have been reported from there, and the nightmare for the public health officials has only begun.
And what about this video conference which the Prime Minister is supposed to be holding with all state chief ministers? I'm hoping that the political, animosity which exists between the BJP and Sena is not getting the better of this press conference. Is Uddhav Thackeray, state chief minister, attending this conference?
Well, absolutely, and that is not an issue. We have seen in the last few days several times Uddhav Thackeray has come out and said that he has had a conversation with not just Prime Minister Narendra Modi but also with Amit Shah, and that things are being smoothened out. In fact, when the centre announced a package for COVID-19, it was the finance minister of the state, who is an NCP leader, who welcomed this gesture of the central government and said that more such gestures will be required. So clearly the political rivalry between the parties in the state and the centre do not seem to be much of an issue when it comes to battling COVID-19 menace, particularly in a state like Maharashtra where the number of cases have already spiked substantially. We are at a 335 now.
Let's leave it there and let's hope and pray that the situation does not get out of control in the city of Mumbai, because you're right, Vinaya, that if it finds its way into the suburbs or into the slums of Mumbai, then you're really looking at a long haul and you're really looking at a scenario where things could deteriorate very, very rapidly. Meanwhile, a new audio clip has now emerged of Maulana of Delhi's Markaz. The Maulana has been absconding since the 28th, but in this clip, he can be heard asking people to cooperate with the authorities.
इसमें कोई शक नहीं कि इस वक्त पूरी दुनिया में यह वबा हम इंसानों के गुनाहों का नतीजा है। इस वक्त یقینی اسباب میں دعائیں، استغفار کی کثرت، اللہ کی طرف متوجہ ہونے اور انفرادی عبادات اور اپنے گھروں میں رہتے ہوئے دعوت اور تعلیم کا اہتمام کرنا ہے۔ یہ اللہ رب العزت کے عذاب کو ہٹانے کا اور اس کے غصے کو ٹھنڈا کرنے کا اصل ذریعہ ہے۔ البتہ ظاہری اسباب میں احتیاط اور تدابیر کا اختیار کرنا، جس میں خاص طور پر علماء حق کی طرف سے جاری کردہ ہدایات کا اہتمام کرنا ہے، نیز ڈاکٹروں کی ہدایات و علاج کا اہتمام، حکومت و انتظامیہ کا پورا ساتھ دینا، مثلا مجمع جمع نہ کرنا، اور ان حالات میں حکومت اور انتظامیہ کی پوری مدد کرنا ضروری ہے۔ بندہ از خود بھی دہلی میں ڈاکٹروں کی ہدایات کے مطابق اپنے آپ کو کوارنٹائن کیے ہوئے ہے۔ یہ احتیاطی تدابیر یقین، توکل، ایمان باللہ کے ہرگز خلاف نہیں، اس لیے ان تدابیر کا اختیار کرنا ضروری ہے۔ جہاں جہاں بھی ہماری جماعتیں ہیں وہ وہاں رہتے ہوئے حکومت کے قوانین کی پابندی ضرور کریں۔ فقط والسلام، بندہ محمد سعد غفر اللہ۔
First, this chief